Good morning, everybody. Today we are going to discuss anatomy of heart. In this session, we are going to discuss external features of heart. Our today's session is on the anatomy of heart. The learning objectives for my today's lecture are: at the end of this session, students should be able to describe heart under following headings. They should know the definition of heart. They should be able to describe location of heart, its size and shape. They should be able to describe borders and surfaces of heart. They should be able to describe apex and base of the heart. They should also know the anatomical relations of heart. Wet specimens at the end of this session will cover dissection part of this lecture. Heart is a hollow cone-shaped muscular pump, beats about 2.5 billion times in an average lifetime. The left side of the heart pumps blood through an estimated 120,000 kilometers of blood vessels, which is equivalent to traveling around the Earth's equator about 3 times. The right side of the heart pumps blood through the lungs, enabling blood to pick up oxygen and unload carbon dioxide. Heart pumps more than about 14,000 liters of blood in a day, or 5 million liters in a year. Heart can be defined as a muscular pump that ejects blood into circulation during systole and receives the same during diastole. It is located in the middle mediastinum. The relations of heart with other anatomical structures in the middle mediastinum are: it is enclosed within pericardium. If we give an incision in the pericardium and take out the heart, it is superior related to the superior mediastinum. Inferiorly, it rests on the central tendon of the diaphragm. Posterior to heart lies posterior mediastinum containing esophagus, which forms immediate posterior relation with the anatomical base of heart. Anteriorly lies anterior mediastinum. As shown in the simplified diagram, heart lies in the middle mediastinum. Inferiorly, it rests on central tendon of diaphragm. Posterior to it is posterior mediastinum containing esophagus. Esophagus is related anteriorly to the anatomical base of heart. Anteriorly is anterior mediastinum lying posterior to the sternum and costal margins, and superiorly lies superior mediastinum. What is orientation of the heart? Heart is placed obliquely in the middle mediastinum. About two-thirds of it lies to the left and one-third of it to the right of midline, as shown in this figure. What is the anatomical position of the heart, or how to keep heart in the anatomical position? Heart should be held in such a way that its flat base is behind and convex sternocostal surface is in front. The end of heart with great vessels should face upwards, and tapering apex will be directed downwards, forwards, and to the left. Convex right border of heart should face towards right. It should be held in such a way that two-thirds of the heart lies on the left side of mid-sagittal plane and one-third of it lies on the right side of this plane. What is shape of heart? Heart is conical in shape. It has a base and apex. Base of the heart faces posteriorly. It is formed by right and left atria, while its apex of heart faces downwards, forwards, and to the left. It lies in the fifth intercostal space inside mid-clavicular line. Apex of the heart is also called apex cordis. Is formed by left ventricle only. It is directed downwards, forwards, and to the left. It lies in the fifth intercostal space inside mid-clavicular line. If the apex is located outside mid-clavicular line, it means that there is enlargement of the heart due to any pathology. Normally, apex is tapping on palpation. Let us compare between the normal and enlarged heart. As shown in this X-ray, apex of the normal heart lies inside mid-clavicular line in the fifth intercostal space, whereas the apex of the enlarged heart lies outside mid-clavicular line. What is anatomical base of the heart? Anatomical base of the heart is formed by right and left atrium, whereas apex is alone formed by left ventricle. Base of the heart lies in the second intercostal space. It is clinically demonstrated by percussion. It represents the upper limit of cardiac dullness on percussion. What is the difference between anatomical and radiological base of the heart? Radiological base of heart is formed by right and left ventricle. It rests on the central tendon of the diaphragm. This is the reason why left dome of the diaphragm is at a lower level than the right dome. However, position of the liver under right dome of the diaphragm also contributes to the higher level of right dome of the diaphragm. What is weight and size of the heart? Weight of the heart is between 200 to 450 grams with an average mass of 250 grams in adult female and 300 grams in adult male. It is little longer than the size of one's closed fist. Length of the heart is about 12 centimeters. Its breadth is 9 centimeters and it is about 6 centimeters thick. Relations of the heart with the surrounding structures. As already said, heart lies in the middle mediastinum. Superiorly lies aorta, superior vena cava, pulmonary artery and vein. Inferiorly it rests on the central tendon of the diaphragm. Anteriorly there are ribs and intercostal muscles. And posterior to the heart, the most important relation is esophagus, trachea, left and right bronchus, descending aorta, inferior vena cava, and thoracic vertebrae. Laterally, it is related to right and left lungs, anatomical borders of heart. Borders of heart are also called margins of the heart. The right border is formed by right atrium and it faces the right lung and extends from the inferior surface to the base of heart. Radiological right border is different from anatomical right border. In addition to the right atrium, it is also formed by superior and inferior vena cava. The right border is formed by right atrium and it faces the right lung and extends from inferior surface to the base of heart. The inferior border is formed by right ventricle and partly by left ventricle. The left border is also called the pulmonary border. It is formed by left ventricle and the left auricle and it faces the left lung and extends from base to apex. The superior border is formed by both atria. The inferior border, as already said, is formed right ventricle and partly by left ventricle, as shown by this yellow dotted line. It rests on the central tendon of the diaphragm. Left border of heart is also called the pulmonary border, is formed by left ventricle and left auricle, and it faces the left lung and extends from base to apex, as shown by this black dotted line. The superior border is formed by both atria. Let us recap the borders of the heart. Right border is formed by the right atrium. Inferior border is formed mostly by the right ventricle and partly by the left ventricle. Left border, which is also called pulmonary border, is formed by left ventricle. It is also formed by left auricle, while a superior border of the heart is formed by right and left atria. Surfaces of the heart are the surfaces of the heart are sternocostal surface. This surface is also called the anterior surface of the heart. Inferior or diaphragmatic surface. Posterior surface is also called base of the heart. Right and left pulmonary surfaces are also described in certain textbooks. Sternocostal surface is also called anterior surface of the heart. It is formed by right atrium, right ventricle, and partly by the left ventricle. On this surface, we can see the coronary sulcus as shown by this arrow. On this surface, we can also see the atrioventricular sulcus or coronary sulcus. This is in fact the anterior part of the coronary sulcus. This sulcus contains the initial segment of the right coronary artery. Another sulcus which we can see on the surface is interventricular sulcus between the right ventricle and the left ventricle. This sulcus contains left anterior descending coronary artery and also the great cardiac vein. Inferior surface of heart is also called the diaphragmatic surface of the heart. It is this surface of the heart which rests on the central tendon of the diaphragm. Two-thirds of it is formed by the left ventricle and right ventricle contributes to one-third of its formation. The two ventricles are separated on the surface by posterior interventricular sulcus or groove. This sulcus or groove contains the dominant coronary artery and middle cardiac vein. Dominant coronary artery is defined as the vessel which occupies the posterior interventricular sulcus. It can be branched from right or left coronary artery. Inferior surface of the heart is separated from the base of the heart by coronary sulcus or posterior part of the atrioventricular groove. This sulcus contains coronary sinus, which is the largest vein of the heart. Anatomical base of the heart is also called the posterior surface of the heart. It is formed by the right and left atria. It is separated from inferior surface of heart by coronary sulcus containing coronary sinus. Why base of the heart is fixed posteriorly to the pericardial wall? This is because of the fact that great veins enter the base of the heart, with the pulmonary veins entering the right and left sides of the left atrium and the superior and inferior vena cava at the upper and lower ends of the right atrium. What are posterior relations of the base of the heart? The posterior relations of the base of the heart are very important clinically. The base of the heart opposes the bodies of the vertebra T5 to T8. When standing, the esophagus lies immediately posterior to the base. What is cardiac dysphagia? This is also called dysphagia megalentensis. It is also known as cardiovascular dysphagia. In dysphagia, there is impairment of swallowing due to esophageal compression from dilated left atrium, as shown in this radiograph, due to enlargement of left atrium, either due to MR or mitral stenosis, causes compression of esophagus, leading to dysphagia, and this type of dysphagia is called cardiovascular dysphagia. What is Ortner's syndrome? Enlargement of the left atrium due to severe mitral stenosis or mitral regurgitation involves left recurrent laryngeal nerve, leading to dysphonia and hoarseness. Also, compression of the esophagus by tense enlarged left atrium leads to dysphagia. Correction of cardiac pathology causes reversal of Ortner's syndrome. Pulmonary surface of the heart. Pulmonary surface of the heart is also called left surface of the heart. It occupies the left cardiac notch. Some authorities also describe the right surface of the heart. To have a recap of the surface of the heart, let us go to this table. Anterior surface of the heart consists most of the right ventricle, with some of the right atrium on the right and some of the left ventricle on the left. Diaphragmatic surface of the heart consists of left ventricle and small portion of the right ventricle separated by posterior interventricular groove. This surface faces inferiorly. It rests on the diaphragm and is separated from the base of the heart by the coronary sulcus and extends from the base to the apex of heart. Left pulmonary surface of the heart faces the left lung, is broad and convex and consists of left ventricle and a portion of the left atrium. Right pulmonary surface of the heart, as already said, the right pulmonary surface of the heart faces the right lung. It is broad and convex and consists of the right atrium. What are the various grooves on the surface of the heart? There are two types of grooves on the surface of the heart. A groove between atria and ventricle and is called atrioventricular groove. It separates atria from ventricles. Interventricular groove between the two ventricles. Atrioventricular groove, also called atrioventricular sulcus. It is also called the coronary sulcus because it surrounds the heart like a crown. It separates atria from ventricles. It is divided into anterior and posterior parts. Contents of the anterior part are right coronary artery and small cardiac vein. Its posterior part contains coronary sinus and circumflex artery. Interventricular groove lies between the ventricles. It is also called interventricular sulcus, lies between the ventricles. Anterior interventricular sulcus separates the right ventricle from the left. It is seen on the anterior surface of the heart. This groove contains left anterior descending coronary artery and great cardiac vein. Posterior interventricular sulcus is seen on the diaphragmatic surface of the heart. It contains dominant coronary artery and middle cardiac vein. To cover the dissection part of the session, let us go to these wet specimen. Identify these structures. This arrow represents the right atrium. Remember, this right atrium forms the part of sternocostal surface and faces anteriorly. Right atrium is separated from right ventricle by atrioventricular sulcus or groove. This groove, as already said, contains right coronary artery and small cardiac vein. Right ventricle forms the sternocostal surface of the heart. It is separated from left ventricle by anterior interventricular groove or sulcus containing left anterior descending coronary artery and great cardiac vein. This left auricle which forms the sternocostal surface of the heart. Above the superior vena cava which opens into the right atrium. Arch of aorta represented by A, and superiorly we can see three branches emerging from the arch of aorta. On the right side is the brachiocephalic trunk. In the middle is left common carotid artery, and on the left side is left subclavian artery. P is pulmonary trunk which emerges from right ventricle. What are the various structures seen in this wet specimen? A represents superior vena cava, C represents inferior vena cava, B represents right ventricle, D represents left atrium. Here you can see the openings of four pulmonary veins. Arrow represents atrioventricular groove on the right side, which contains the right coronary artery and small cardiac vein. In this wet specimen, A represents left atrium. You can identify it by its position and number of openings. B represents right atrium. C represents right coronary artery continuing into coronary sulcus. D represents the right ventricle. E represents posterior interventricular sulcus containing dominant coronary artery. In this case, this coronary artery arises from right coronary artery. In this specimen, you can see the sternocostal surface of the heart. A represents pulmonary trunk originating from right ventricle. B represents left anterior descending coronary artery arising from the left coronary artery. C represents atrioventricular sulcus containing initial part of the right coronary artery. D represents origin of aorta. In this specimen, A represents the base of the heart. This is anatomical base of the heart which is formed by the two atria. B represents inferior surface of the heart which is formed mainly by the left ventricle and partly by the right ventricle. C represents posterior interventricular sulcus or groove containing dominant coronary artery. Again, this is the sternocostal surface of the heart. A represents the right atrium. B represents aorta. Remember, aorta lies posterior to the pulmonary trunk. On dissection table, you can differentiate between the pulmonary trunk and aorta by keeping in mind that it lies posterior to the pulmonary trunk. One. Second important point is that if we see the wall thickness of the two vessels, aorta since it pumps blood into systemic circulation in contrast to pulmonary trunk which pumps blood into pulmonary circulation. So the thickness of aorta is 6 times more than the thickness of pulmonary trunk. C represents right ventricle which forms the sternocostal surface. D represents pulmonary trunk originating from the right ventricle. E represents left ventricle which forms one third of the sternocostal surface. F represents right coronary artery in atrioventricular groove and G represents left anterior descending coronary artery in anterior interventricular sulcus or groove. What are the various structures you identify in this wet specimen? A represents the brachiocephalic trunk. It is this trunk divides into the right common carotid and subclavian artery. B represents arch of aorta. C represents superior vena cava opening into the right atrium. D represents right atrium. E represents sternocostal surface of or right ventricle of heart. 1 represents left common carotid artery arising from the origin of the aorta. 2 represents left subclavian artery. 3 represents left auricle and 4 represents left ventricle. Let us go for a quiz based on this lecture. You will be provided an MCQ with 4 options. You have to choose the most accurate one. Our first question is human heart is located in which mediastinum? Anterior, middle, posterior, superior. Middle is the correct option. Anatomical base of the heart is formed by which structure? Right atrium, left atrium, both right and left atrium, right and left ventricle. C is the correct option. It is formed both by right and left atria. Our next question is which of the following statements is false about anatomical base of heart? It lies in the second intercostal space. B. It is formed by the left and right atrium. C. Predominantly formed by the left atrium. D. Trachea forms its posterior relation. D is the wrong option. Which of the following statements is true about right border of the heart? It is formed by the right atrium. B. It is formed by right atrium and superior vena cava. C. It is formed by right atrium and inferior vena cava. D. It is formed by right atrium, superior vena cava and inferior vena cava. So A is the true statement about the right border of the heart. It is formed by right atrium. Which of the following statements is false about apex of the heart? A lies in the fifth intercostal space. B formed by the left ventricle alone. C normally tapping. D. It is directed downwards, forwards and to the right. D is the wrong option. Which of the following statements is false about the sternocostal surface of the heart? A. Also called anterior surface of the heart. B. It is formed by right ventricle 1/3 and left ventricle 2/3. C. Anterior interventricular sulcus is seen on the surface. D. left anterior descending coronary artery is seen on the surface. B is the wrong option. Which of the following statements is false about posterior surface of the heart, also called base of the heart? B. It is related to the esophagus. C. It is separated from inferior surface by coronary sulcus. D. It is formed mainly by the right atrium. D is the wrong option. Which of the following is not a content of posterior interventricular sulcus? A. A branch from the right coronary artery in case of right dominance. B. A branch from left coronary artery in case of left dominance. C. Middle cardiac vein. D. Small cardiac vein. D is the wrong option. Which of the following is not a content of anterior interventricular sulcus? Left anterior descending coronary artery. B. A branch from the left coronary artery. C. Great cardiac vein. D. Small cardiac vein. D is not correct. Small cardiac vein is not a content of anterior interventricular sulcus. Our next question is, which of the following is a false statement? Dome of diaphragm is higher than the left dome of diaphragm because of liver. B. Left dome of diaphragm is lower than right dome because heart rests on it. C. Right radiological border of the heart is formed by right atrium, superior vena cava and inferior vena cava. D. Radiological base of the heart is formed by right ventricle alone. D is the false statement. Do not forget to like, subscribe and share this video. Thank you for watching.